Opioid Use Disorder in Pregnancy in Rural America by Charity Douglas. The opioid crisis in the United States has reached an unsurpassed percentage in the last few years. It's estimated that 48.5 million people in the U.S. reported using illicit drugs or abusing prescription drugs in the past year. Statistics revealed that the use of opioids during pregnancy increased from 1.19 to 5.63 per 1,000 hospital births. Neonatal abstinence syndrome is a term used to represent a category of signs and symptoms that are typically associated with neonates who have had polysubstance exposure in utero. The average length of stay in the hospital for neonates born with NAS was 16.9 days in 2012 and costed an average of $1.5 billion. Guidelines for treating the pregnant patient who has opioid use disorder includes comprehensive OB care with initial screening for substance abuse at first prenatal visit and routine screening throughout pregnancy. First-line treatment is medication-assisted treatment with either methadone or Suboxone. This helps prevent pregnancy complications and reduce opioid withdrawal. It is recommended that pregnant women with opioid use disorder be encouraged to start an MAT program with counseling rather than attempt detox on their own, as it runs increased risk for fatal maternal and fetal outcomes. ACOG released recommendations that stated that detoxing from opioids while pregnant should be avoided at all costs due to risk of harming the fetus. Where does the health disparity exist? The health disparity occurs in that pregnant women are being placed on maintenance doses of methadone or Subutex during pregnancy and are not being appropriately tapered so that they can eventually achieve a full recovery during pregnancy before delivery. Not tapering or detoxing results in increased cases of neonatal abstinence syndrome. What does evidence-based research say regarding detox during pregnancy? One study found that patients addicted to opioids were fully detoxified during pregnancy with no adverse maternal or fetal outcomes. One study also found that tapering more than 50% of the initial dose was associated with higher birth weights and no evident harm to mother or neonate. As new research emerges regarding detox during pregnancy, guidelines must be updated as current guidelines lack extensive protocols for detox and tapering during pregnancy. Challenges for the rural pregnant woman include lack of access to an MAT program, lack of doctors approved to do MAT, and rising rates of poverty and unemployment. Opioid abuse in pregnancy and NAS rates in the rural part of America has hit epidemic proportions. Current guidelines for treatment in pregnancy is lacking. New research is needed to bring forth new recommendations to help reduce the health disparity.